we're in this interesting point now in the United States where some spots, some of these hot spots are fully engaged in the response, whereas others are not so much and are in the preparedness phase. So from a healthcare perspective, you only have two pockets of the healthcare community, one fully engaged in response, and the other where hospitals are really taking all the steps to prepare for this. There are certainly some encouraging signs around the country that the social distancing measures are actually having an impact. But from the healthcare perspective, we have to assume that we're going to see a surge and we have to prepare for it. This is an interesting time because it's that time when we go from, in healthcare, from a doctor, let's say, caring for a patient to more community medicine or public health. And really, community medicine is not something that just doctors and nurses can do. We can treat patients very well, but we can't treat the entire community very well without the help of the community. So that's why it's so important, and you've heard it so much and so often by Dr. Fauci and Dr. Birx and others, this social distancing measures, which are rather draconian, rather hard to live through, but they're so important because it's the idea of blunting that curve that we really need to do. So what is the end goal? There's a lot of questions now that we're in this, in these social distancing measures and this home isolation. What is the end goal? Where is the light at the end of the tunnel? How do we start lifting some of these or down-regulating some of them? It's not going to be that suddenly one day we turn the light switch on and the entire United States is completely out of these social distancing measures. That's probably not going to be the case. I think that the decisions is going to be regional based on what parts of the country are in what situation in this crisis, whether it's preparedness, response, or recovery. And then also I think it's going to be probably incremental. We're going to lift some of them, then we'll lift a little bit more, then we'll lift a little bit more, and we'll proceed that way. So the next logical question is, what is the end goal? What are we trying to get ourselves to through this social distancing system? And really, we're looking to get ourselves to three specific goals, either one, two, or all of them together. One of them is a vaccine. Of course, a vaccine is going to help so that we don't have as many people that can catch the disease. Another goal is going to be therapeutics, so medicines that actually treat the disease. And a third is going to be this development of herd immunity that you've been hearing about. So let's talk about each one. The vaccine, as you know, has been touted to be coming maybe in a year, maybe a year and a half. Therapeutics, we're not quite sure exactly when they're coming online, but there are a lot of tests, a lot of trials going on now as we speak. We just don't really know a lot about them. You've heard a number of them, like hydroxychloroquine, some of the antivirals. There's a number of things out there that have shown some sign of maybe working, but unfortunately the studies done so far and the anecdotal data we have so far don't really scientifically support that, yes, they do provide as a treatment modality for this disease. So it's a matter of developing a vaccine and going through clinical trials of therapeutics. Right now, we're not quite sure on the therapeutics how long that might be. It might be months, it might be 6 months, it might be less, we don't know. The other piece of this that might factor in, I can't say this for sure, is the idea of implementing what we call crisis standards of care. One thing that we do in disasters is that sometimes we don't provide health care in the way that we normally provide it because of the surge of patients we're seeing. We're seeing a little bit of that now with the development of these field hospitals. So when you care for patients who would normally be inpatient in the hospital, when you care for that patient in a non-hospital setting or outside the hospital in either a field hospital, in a convention center or a park or where we set these up, that's already beginning to look like a little what we call crisis standards of care. It's not quite the care that we provide during normal times, but it's the care that we have to provide during this time of the pandemic. Another aspect of crisis standards of care might be and could be pushing those promising vaccines and promising therapeutics through the system a little bit quicker. So right now we have to assume that we're not going to see a vaccine for a year to a year and a half, but there are possibilities we might see it sooner if we decide to go through this crisis standards of care practice. So those are two of the three end goals. The other end goal that we're looking at is the herd immunity. So COVID-19 is a novel virus, and as such, we don't have all the information out about it yet. We will know a lot more later. In fact, we'll know almost everything about it later. We just don't know some things right now. One of them is immunity. We don't know if when you get sick from COVID-19, you then are conveyed some degree of immunity, and we don't know how long immunity might last. Given that, and also given the assumption that you have some degree of immunity, we start creating in those people who have been infected and have gotten better this idea of a population of immune people, or the herd immunity. What that does actually dramatically mitigates against the transmission of the virus, because now walking around society, you don't have 100% of people who have never been infected by this virus and therefore are vulnerable to it. Instead, maybe you have 70% and 60%, 50%, 40%, 30%, because you have that much more immunity out there in the population. And that means that there are fewer people who are actually able to get the disease new and then pass it on again to somebody else to transmit it. So that goes a long way towards mitigating against the transmission of the virus. So these are really the three end goals that we're trying to get ourselves to through these social distancing modalities. Medical conditions, emergency medical conditions are essential. You need to still care for yourself and be cared for if you have an urgent or emergent condition. You know, heart disease doesn't go away, respiratory problems don't go away, diabetes doesn't go away. So if you have an emergency problem or an issue, you need to still go to the emergency department and be treated. In those places where emergency departments are right now in the hot zone and they're working at beyond 100% capacity, a thought is that if you do have a laceration, let's say, that perhaps with the different capabilities that you have at home, you might be able to care for that yourself. If there's any doubt, I would say just go to the urgent care or emergency department to have that laceration cared for, repaired. If there's a question, then maybe call your primary care physician up, maybe have a video conference, let him or her take a look at the laceration and make a recommendation to you that, yes, with the capabilities you have at home, you can actually, do a closure of that wound at home versus going into the emergency department, or no, maybe you should go into the emergency department. So these are sort of judgment calls you need to make. I would suggest that if you have any question at all, whether, let's say in this case, we're talking about a laceration, whether a laceration should be cared for in the emergency department or not, probably contact your primary care physician, let them weigh in on the decision by taking a look at it through your video conferencing capability. And if that's not available to you, if you're not able to do that, then I would just essentially go to the emergency department and take the more conservative route. So this is the population you really want to protect, you really want to safeguard, because they are more vulnerable. So again, you've seen, we've stopped visitation to nursing homes in many states. We have limited how much contact they have. It's unfortunate. It's nice to be with your family members, to be able to communicate and speak with your family members face to face. It's really, unfortunately, during this pandemic, it's a concerning thing to do, given how vulnerable the older population is. So in that age group, again, you would look at either the illness or the injury that they have, and make it an educated decision about what to do. If they do, let's say in this case, as we spoke about before, get a laceration, you should really look at that laceration and say, okay, is this something with the capabilities we have here in the nursing home? Is this something that we can repair here? Or really does need to go to the emergency department to be repaired. And any of these illnesses or injuries that you feel comfortable that you can repair within the nursing home, and perhaps you seek medical consultation on that, perhaps you get the physician in the nursing home to weigh in on that. But anything that you feel that you can care for in the nursing home, as opposed to sending out to an emergency department, would be a good thing to do, because they are at greater risk.